Hello and welcome to the next session of the McKnight Senior Living Expo. You've tuned into Elevating Senior Living Care Quality Through Trusted Partnerships. I'm McKnight Long Term Care News Senior Editor Kim Marcellus, and I'll be with you throughout today's lively discussion on staffing partnerships and resources. I'll introduce you to our speakers in just a moment, but first we have some housekeeping matters to take care of. We don't have slides for today's presentation, but keep in mind that this session and all of those from the Expo will be available to watch on demand and can be shared with others shortly after the live event. I'll give you more details on that at the end of today's conversation. If you have any audio problems during today's presentation, please first check the volume control on your device. This is the most common cause of sound problems. You can also use the help button if your own troubleshooting doesn't work. We will have time for a Q&A near the end of the presentation, so if you have any questions at all, please feel free to submit those starting right now in the panel on the left side of your screen. Now, regarding continuing education, this educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards. It has been approved for 1 clock hour. However, you need to stay tuned into the event for its entirety during this original broadcast to receive a certificate. You can track CE requirements through the course completion tracker, which is accessed through the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display, and the required viewing duration will have a green checkbox. You can then view or save your certificate. A copy also will be emailed to you afterwards. So let's jump in. And first, I want to apologize. I'm having some technical difficulties, so I won't be on camera with you today, but our wonderful guests are, and I appreciate them all for being here. First of all, the topic today. We all know the quality of care in senior living facilities is at serious risk given today's tough operating environment. With the incredible rate of nursing staff turnover, something has to be done to address the heavy workloads, unsafe staffing levels, and limited resources that are driving nurses and aides out of our profession. But you can't do it alone. And that's why it's more important than ever that we critically examine the distrust in vendors given rise by the pandemic. It's time to explore ways forward through transparent, trustworthy public and private partnerships that establish new ways of delivering workplaces that are safe for nurses and will sustain the senior living sector. So joining me today is a panel of experts, each with a unique perspective on the nursing profession, industry partnerships, and what needs to be done to overcome the workforce shortage. First, we have Rebecca Love, Chief Clinical Officer at IntelliCare. Trish Richardson is Chief Nursing Officer at CareWork. Peter Murphy-Lewis is host of the LTC Heroes podcast. And Brooke Myers is Director of Nursing at a senior living facility in Rhode Island. Welcome, everybody.
Thank you.
So we're glad to have you guys.
Thanks to be here.
We're going to go through 5 big questions, and we're going to give everybody a chance to weigh in on the ones that they feel they really have something valuable to share with you. So I hope our audience is ready and is excited about this topic as we are. Rebecca, we're going to start with you. It's obviously, again, a very diverse panel here today. And I'd like to ask each of you from where you sit what the biggest barriers are that prevent us from building sustainable nursing workforces. What do you see, Rebecca?
Kim, thank you for that question. And I think there's a thought in the marketplace that we don't produce enough nurses in this country, but actually we graduate 250,000 nursing students a year into the profession of nursing. That's actually an increase of 15% per year over the course of the last 5 years, according to research out of the University of Pennsylvania done by Linda Agan. So we produce plenty of nurses in the United States. In fact, it's the largest graduating profession of any profession in the United States. And when you look at that, the problem that we have is that we don't retain them. And this isn't unique just to long-term care. It's unique to almost any care setting that exists. Prior to the pandemic, we lost about 57% of new nursing graduates prior to the pandemic. We believe that the last few years, the largest demographic of nurses to be leaving the profession are those with under 1 year of experience. Now, this is a problem that we have known about for a very long time, in which we've done little to address the retention of nurses by the bedside. Now, one of these things that we should definitely be making some awareness to as well, specific to long-term care, is that most nursing students students are actually never trained in long-term care during their entire nursing school enrollment. That means they graduate unprepared to even work in long-term care, which is probably leading us to continue to having that sustained shortage in long-term care, which I think just recently ACA put out that we're still 190,000 caregivers short in long-term care across the country, when we had reached a high of nearly 250,000 caregivers short in long-term care during the height of the pandemic, which has not rebounded like it has rebounded in most other care settings. So I think we want to start the conversation there. We graduate and produce plenty of nurses, but the truth is we do not retain them. And why we're not retaining them is something that I think through the conversation that we have today, everything from pay, safe staffing levels, ratios, to other environmental things that we need to be doing to keep nurses by the bedside and our aides, because they are our pipeline to producing future nurses, is absolutely critical and part of the conversation that we're going to be having today.
I really echo that sentiment, Becca. As someone who was once a CNA and is now a nurse, that is the direct pipeline. And where I sit, staffing sustainability lies in doing two things very well. One is prioritizing the emotional and physical safety of nurses above all else. If that means that we miss meetings to give lunch breaks, then that is what we do. Secondly, stopping that bleed, this turnover that we're talking about. The average cost of a turnover, according to the National Revenue Agency in 2023, is $40,000 to $64,000, depending on your market. Considering those costs, we know that we need to give better retention compensation, not just in pay, but in benefits. And this can look like increasing opportunities for furthering your education. What would it look like if every single floor nurse was a diabetes certified or wound certified nurse in your facility? Because to me, that looks like adding value to care. And really, as we go along here, I really hope that we can wrap around this conversation of how we can direct CNAs into nursing schools, because you're right, the shortage isn't there. It's a shortage of humanity. And we really need to boost that up in order to keep these girls and all of our CNAs retained in that pipeline.
I agree that retention is probably the starting point for combating, what's going on right now. But I also think that it's a framework. There's a paradigm shift that we have to have in the way that we see the problems. We can blame the government. We can talk about reimbursements, but it's not about me against staffing agency. It's not against me against my local competitor. I interviewed a person on my podcast, John Weir, who said, when the pond shrinks, you start to look at your competitors, you start to look at the fish around you a little bit differently. And that's why he went to his competition and they funded a nurse educator program in their local high school, splitting the salary so that they can graduate 98 CNAs next semester. We just need to think differently. This is not about us against the staffing agency. This is us against the rest of the world. We need to recruit people to not go into Walmart, not go work at McDonald's, bring them into long-term care.
Oh my gosh, I love this conversation for so many reasons. I'm thinking about, we talked about the recruitment, and Brooke, you brought up some amazing numbers, and it is around 55,000 is the average, is the last I saw. So 40 to 60 is right in the ballpark. And then there's this thing called inflation. And then you have all of these new, I'm talking about another barrier here, when you have all these minimum staffing mandates that are coming out, and that is promised. I think that ACA said we might see something from the government, by the 21st of this month. Don't want to go down that road because it's not here yet. We don't know what it's going to be. But that's another barrier too, because you think about from the post-acute perspective, post-acute has so many subverticals. So you think skilled nursing, you have one set, and then you have regulations on top of that. Senior living is a little different. So if you have a federal minimum staffing mandate in skilled, what is that going to do to the candidate pool for senior living? So there's a lot to consider there. And in the greater context, we are going to see an influx of a total of 75 million seniors that need care by 2031. And when you talk about the average right now is 95 days, it's over 3 months to recruit one nurse. That was from the National, I don't say NSI, I don't want to mess it up, NSI report from 2020 for this year, 2023. 95 days to recruit one nurse. And another stat, I love my data, 50% of new grads are leaving within 2 years. And that speaks volumes, because you have nurses, around 50% of nurses are about 55% are over 50. And then you have those seasoned, and I'm one of them. So then you got seasoned nurses who are leaving the bedside. And then you have some that are new nurses that are being asked to take on more responsibilities. Then you have workflow issues. You have ineffective and inefficient workflows and processes. They can't do their job. And then we'll get into more of the discussion around the retention and some of the other barriers. But that's a big point of contention, is that the workforce that's there is overworked and overburdened. And then you think about the other barriers that are on top of that with regulation. Again, we're not going to blame the government, but just in the context of the conversation, it has to be discussed. You think one of the things, I think, Peter, you brought up too, about, nurse aides and how they've got this new program. I remember working in the post-acute space as a clinical nurse executive, and we had a CNA career ladder. And oh my goodness, the nurses that would come in at stage 1, stage 2, stage 3, what it meant for them. Brooke, to your point, giving them the tools and resources and encouraging them and emboldening them and empowering them to do their job to the best of their ability, and then show them that, Walmart may give you, I don't want to say Walmart, ABC company might give you $17 an hour. We might be able to give you 15 or 16 and all of this. And so there's so many, I'll pause there and hand back off to Kim, but I so many great conversations to be had today.
And Trish, I appreciate the point you made about the mandate, because I am typically writing about skilled nursing in my day job. And I think it's a great illustration of how we can't just think of what's happening in my building. Whether you're talking about those competitors in other sectors who want your workers as well, whether you're talking about other people on the care continuum who are also desperate for aides, nurses, up the ladder. The fact is that you guys are not doing this alone. Everybody is looking. So let's talk a little bit. That's kind of the theme setting. How do we overcome these challenges? And I'm going to start with you this time, Brooke. Partnering with an industry vendor can introduce its own set of financial and quality related obstacles. So what are some of the major challenges facilities encounter when working with vendors in the industry? What have you seen?
Thank you for the question. In my experience, facilities and organizations need to drop their egos and evolve past the negative assumptions about working with agencies and vendor partners and what that can really look like. Denying the need for the partnership is usually where the problems start, and it only delays the great work that we can do with each other once those partnerships are forged. I also find that it creates a sense of urgency, and we kick the can down the road rather than working on fostering that relationship as the need grows. And I do understand the hesitancy and the concerns about quality and financial burden, but I also know that from my work, when you partner with the correct vendors who are responsive and vet their staff well, and you work with them to ensure that the quality is there, that residents do get better care. Ultimately, this does drive down costs across the whole system at large and creates opportunities for retention in a continuum of care. And this is the way forward. As skilled caregivers begin to understand, as all other vocations have, that they are agents of their own license, I just encourage all of you to forge these relationships now before your situation becomes so devolved that you're feeling this sense of urgency. And as far as quality, everything that happens in your building is in your control. And I encourage you to hold your care partners and your vendors accountable. And I can give you some tools today to do that. I know that that seems more intimidating than it is to tell someone else how to run their company or do their job. But when folks step in your building, they are your staff. And I encourage you to take that authority.
Brooke, I really appreciate you saying this, because I think that the truth is that we know that three things come along with staffing agencies a lot, right? There's increased cost. Often people feel that by you're paying more for lower quality of staff that lead to greater amounts of incidences and potential increased cost because of those incidences working with staffing agencies. And I think that for a very long time, that was absolutely correct in many situations of many of us that have been nurses and have worked with agency in the past. And part of my own personal experience and working now in staffing was coming in with a new commitment to say, we have a challenge here that the truth is those many nurses that are not going to work in traditional settings, how do we amplify and accelerate them to work in a per diem capacity in a way that also drives quality care delivery when they show up at these locations? And I think fundamentally what that means is that you should be looking to your staffing partners to make sure that they have a clinical quality team to address the issues that come up first at hand. Now, not only should you have a clinical quality team doing investigation, but the truth is there should be a strong commitment by those staffing partners to retrain, upskill, and educate those gaps within their own workforce to make sure that they're sending you quality providers. And I think if we start looking at it this way, to expect more from our staffing organizations, because they should be a partner in us in delivering quality care, because at the end of the day, what should matter is the patients in those beds and the outcomes that they have. And that is going to be the staff within your own facility, supplemented with agency staff based on these extreme shortages that we're having. That I really love what you're saying is that fundamentally, they are under your control. But the truth is I think that you have the right to start expecting more of your partners to drive better quality within your organizations. Because if they're not doing that, then the truth is that I'm not sure that they deserve to deliver care within the settings that we are managing some of our most critical population today. But I would love to hear, both from Peter and also, again, from Trish on some thoughts about this.
Related to what you said about skilling up, I actually did a tour. I work for an electronic healthcare records company. I did a tour of a facility in Tacoma about a month ago. And the person who was giving me the tour said, hey, can I introduce you to our staffing agency? Because a good percentage of the people know the software, but they're having problems with this module. Can I make sure that this is going out to all the CNAs, the med techs, and the nurses, and they get reskilled up on this? And I said, of course. So you got to be comfortable asking your partner to step up with you as well.
No, that's a great point. It's a great point. And I just bring back to in my experience as a nurse educator on the acute side and the post-acute side, when we would bring in our travelers, our agency staff. For example, there was one time when we were moving from one EHR vendor to another, and we had to staff up pretty quickly. And at one orientation session of my 75, almost 100 staff that were coming in to be oriented, over half, almost about 75% were travelers, and they were agency staff. And so when I brought them in, I thought, you guys are part of the UNC Rex family. You're a part of this family. And we trained them in the same way right alongside our full-time, our FTEs. And it made a difference. They felt empowered. They felt a part of the organization. They understood the culture a little better. We called them, we Rexified them, right? We helped them to feel more accustomed and to assimilate into the culture a little bit easier. And we had a relationship with our vendor. And, what we're doing, today, and I can speak as a vendor, not on the staffing side, but as a vendor, finding someone, Brooke, to your point, that understands your need, understands where you are, and appreciates and respects and values and validates the concerns that you have, and I think about the opportunity to upskill clinicians as well. And then you have the right staff and the right staffing agency you're working with. You can bring in those confidently and competently, bring in those higher admissions that can also absolutely increase your care quality scores. And Brooke, you said something earlier, and you talked about, let's just go ahead and start these relationships. Why are we waiting? Why are we doing that? When you think about the care quality, again, Rebecca, to your point, the care quality scores that you're reporting are 2 years old. So the refusal to pivot, you're baking in losses. And so it goes into any vendor that you might be working with, but specifically around clinical quality and the care, safety of the care environment, and helping our travelers, our agency staff to come in, to feel assimilate more easily, be a part of the culture, and to know that they, alongside your regular staff, but your FTE, your full-time staff, that they together are impacting and transforming the lives of the patients and residents in their care. So give them the opportunity to come into those buildings. And I've seen it work in the acute and the post-acute space. It is transformative. And the relationship that they build, I had one agency staff come to me at one point and say, I wanted to come work at your hospital, and I came in as an agency staff, and I'm going to wait my 6 months because then I can come in and actually actively pursue a full-time job. Is that because I know this culture? And you made us feel this culture from the moment we stepped in. So that's just a great point that you all were making.
Appreciate those real world insights. And we're going to come back a little bit later and get more of that. But for now, I'm going to stick with you, Trish. I think I want to go a little deeper here with what you were, I think, just leaning into a little bit and talk about some of the ways innovative partners can actually provide assistance instead of being somebody you have to rely on. They become somebody you want to rely on. It to both of you can be better together. So when it comes to things like patient outcomes specifically, improved operational efficiencies, and reducing your financial risk. Can you talk a little about what partnerships can provide tangible benefits?
Oh, absolutely. Thank you for the question. And, as a vendor, CareWork, we are the one and only unified operations platform in senior living and senior care. But I want to take a step back, because when you talk about the possibilities and what you can accomplish together with a partner and operational efficiencies and financial risk, all of those things, I love my data. I want to go back to some research that just came out in October this past year, where there was a research survey that came out that said 25% of clinicians today are leaving healthcare. They want to leave healthcare. They're actively pursuing an out. And of the 25%, I read that almost 90% cited burnout. And of the 90%, I'm going to go a little deeper. Of the 90%, 40% said that they don't have the resources and the things they know they need to do their job effectively and efficiently. And they specifically called out workflows, inefficient and ineffective workflows and processes. So I take it back to the conversation around vendor partners. So if you know what you're doing is not working, and Brooke, to your point earlier, if you're not going to pivot, you're just going to keep doing it the same way because you've always done it that way, you're baking in losses for care quality. And in the end, not only do you have financial risk, but you have care quality outcomes that are diminished, and the experience of the patient and resident is also in play. The safety of the healthcare environment's in play. So when you think about a vendor partner, you want to find someone that's been there. You want to find someone that truly understands you, listens to you, appreciates you, respects you, validates your concerns, and says, I've been there. Or someone on our team or someone in our organization has been there. So the key for me about finding and working with a partner, a true partner, is the trust and the respect that goes along with the partnership. Because we at CareWork, we understand what it means, for example, workflow inefficiencies and ineffective processes, and what that can mean positively and negatively for your business operations. One example that we've worked with one of our clients, VP of Clinical gave us some data and said the workflow automation of of your unified operations platform, the automated workflows, the things you put into place have saved me over 80% of administrative time. And we were blown away. And so I think if you think about what that means, Kim, you mentioned several things: operational efficiencies, risk, and finance. When you think about workflow automation, in my experience, what I've seen, and also working with clients, with workflow automation, you're going to improve your operational efficiencies, patient experience and outcomes improve, survey performance and risk mitigation also improve. You see, so it's multi-layered. You may think of one issue that you're having, but working with a trusted vendor partner will give you the things that you need, the tools that you need to empower your senior leaders to say, we're going to ask you to do these new things a different way, and give you the solutions and tools that you need to do them, and save you the time so you can do what you want to do. And as a nurse, this is where I go. I want to get back to the bedside. I want to get back to the bedside and work with my teams. So in the end, we talked about retention. You're going to improve just by changing your workflows and improving your processes through a trusted partner relationship, recruitment, retention, engagement, and satisfaction. And there is also, you're improving your financial health and wellness of your organization. But the key is a trusted partner who's been there and understands you and will stay with you side by side and help you through that process. That there are partners that you can find that will do that for you. And at CareWork, we're bringing your clinical and financial together into one platform, single source, to give you back that critically needed time to do the things you need to do to get the job done. And in the end, you're going to be able to recruit and retain the staff and help to stave off the losses of those who want to leave the bedside.
That's great, Trish. And I echo your sentiments. I believe it was Edwards Deming who said, in God we trust, all others bring data. And we do need the data. And the data is so important. And it's made more complicated than need be by these regulatory bodies and reporting agencies and the initiative pipeline, which initiatives may or may not be adding value or mitigating risk, really, or improving quality for that matter. And we know that nursing is two things. It is both an art and a science. And we're able to leverage those skills when we have the ability to synthesize the data separately. And then the nursing part is how we translate that into practice. And that's when the art comes in, right? Use your creative problem solving, think with your nurse brain, put that foot first. leave the data to a computer. And I think that's really where the future of these partnerships have a lot of ability to grow in a progressive space, is by letting nurses be nurses, letting the numbers be numbers, and not asking nurses to translate analytics and figure out really all of these algorithms or where the data needs to go. Who needs to get the data? Who is it relevant to? It's probably relevant to all of us, but let us translate it. Let us figure out how we're going to implement those processes, but the collecting and the transcribing can be left to programming.
I think that's so well said, Brooke. And I think the truth is that sometimes we look at long-term care, we look at other care settings, and we've been so hurt or burned by very complicated technology and rollouts that those SaaS solutions have just created more work for us, cost us more money, and not driven the outcomes that we've wanted, because they're highly technical in their delivery. And I think the reality is that we now have been through that first 10 years of new technologies rolled out, and this next iteration is bringing really valuable information to us. And I know within our own platform, one of the things that AI has done very effectively for all of our nurses as well as all of our facilities is based on use and trends and specific information. AI is now able to help better predict your future forecasting on the needs of your staff, where you may have gaps within your current schedules, and being able to partner and pair you with the right amount of nurses or CNAs that you're going to need to keep you at a census level that's going to drive your highest level of reimbursements. And I don't think we had that 10 years ago. And the pandemic threw everything into a tailspin for us to be able to operate. And the reality is there are technologies today that if we use them effectively, it will drive greater organizational efficiency. But more importantly, it will start allowing us to staff our buildings in ways that drive forward the best ways for us to maintain high quality delivery of care, eliminating burden on our frontline staff while making sure that we're driving patient outcomes for the highest levels of reimbursement across the spectrum. So we have to figure out ways to merge the data, the technology, and the human all into this process, and trust in partners who, let's be very honest, our nursing homes and hospitals are not going to invest millions of dollars into technology to maintain a small vertical of some specific business. But who will is these private industries who are going to become the experts in those delivery systems and will be able to drive you better outcomes because you work with them. And I think these are things that the trust has been broken because of what happened during the pandemic. But the truth is that there is really great sources out there that if you are willing to re-engage with those partners, you should be driving better outcomes across the entire long-term care industry at scale.
So Rebecca, you mentioned the T word. We're going to go back to trust now, and I want to bring Peter in. Obviously, a lot of opportunity to benefit from these partnerships, but first you have to have faith and take that leap that you're willing to work with someone. So Peter, what are your thoughts on how we can begin to build that trust? What measures can you take to vet potential partners and ensure that both sides enter relationships with similar goals that really aim at improving care quality?
So I'm going to answer the question more from a human point of view, more from me being a CNA, me from being a podcaster than being VP of marketing. I think that it's really simple. I think it's like almost how we make friends in high school. When I am going to meet my new boss on the floor as a CNA, or I'm going to interview somebody on the podcast, I usually try to figure out what their love language is from the book, The 5 Languages of Love. I try to figure out what makes them tick. I try to figure out how can I make them feel appreciated? And then I create that human relationship. You have a drink with them at the social hour at a state convention. Then you see who they talk to. You see how they treat their peers, how they talk about their boss. Pay attention about how do they talk about their competitors as well. That's how you start the vetting process, in my opinion. To give you kind of an example of how a partnership started with Rebecca here, Rebecca Love. I remember she reached out to me about 1.5 years ago and she said, Peter, I want LTC Heroes to interview every single one of my nurses during Nurse Week. And I want to use those interviews to bring more people into long-term care. So I want you to talk about all of the intangibles about what's special about this industry so that the facilities and IntelliCare and our competitors can go use those and Facebook ads and TikTok ads to bring more people into this industry. And it just started off with a little bit of trust. And then I got invited back again. Thanks, Rebecca.
Always, Peter. And I think, I think the truth is that For many of us, I mean, everybody on this panel is either a CNA or a nurse. And the truth is why we got into healthcare was to deliver better outcomes for patients. And I think that there is a way to align business practices with actually delivering better outcomes for patients. And I think sometimes business gets in the way of that. And we have to be able to look back, as Peter just said, to the human connection of how people express this, because the truth is, at the end of the day, what only matters is how we can deliver care that's going to drive to make sure that those people living in long-term care today are residing in communities such that take care for our seniors, that they can thrive. And we know that they're not. They're not thriving today. And we know that the way that we've been doing business is not working to go on a go forward basis. So we really have to look at new partnerships and sit there and say, look, this is not just good for me personally. This is good for the industry. And I think that's where we have to come back to. And so I'll turn that back over, to the other panelists. But I think this is why you're seeing 4 of us coming from very different backgrounds to have this, because we recognize that if we keep staying in our silos and we keep seeing each other as the competition or the enemy in this, the truth is the only people that it's going to hurt is ourselves, because we separate, we're all going to fail. If we come together in a unified way to work together and establish core outcomes, your success is our success. The truth is we're going to elevate the industry and we're going to beat back the challenges that we've been facing, which is more regulations, more skinning down of reimbursements. Because when we actually show there's pathways to success that drive better outcomes, guess who's going to get behind that? The federal government, the organizations that regulate this space. The reason they drove more regulations down on us is because we are not achieving what we're supposed to be doing within our verticals. So Brooke, Trish, what are your thoughts on this?
I love that you said that. And I think some of this distrust comes from really our own insecurities, right? How do I know if your staff isn't operating at the level I need them to within my facility? Well, how do you know if they are? And the answer is the same way that we know if our own staff is doing it, because of the feedback we get from our residents. And having that open line of communication from the people that you take care of is valuable. And be choosy with your care partners. It's okay to ask hard questions, understand their core values and how they align with yours. What does their system of support for their staff look like? Because if your staff are more my staff, I'm their system of support. And as long as you have that level of understanding that your office is open, they can come to you. I've written letters of recommendation for my IntelliCare partners and for other agencies that are within my building, physical therapists to go back for their masters. We've done it all. But create partnerships with people whose vision of care delivery aligns with yours and leverage that as a united front rather than acting as these pillars of care that we ask both our staff and our patients to go between, because navigating that in this space is going to become impossible, to Trish's point, as we get this influx of people needing care and this max exodus from the bedside, not in a lack of graduating. I was a vocational student. I got my CNA at 16 in high school. I've been in it, I'm staying in it, but I know that my counterparts that I graduated with, most of them have since left because they don't see this as sustainable for themselves or for their families. And I can't blame them, but it's our responsibility to shift that paradigm and move this industry forward the best way that we know how, which is together.
Yeah, absolutely. And just thinking, you brought me right back to when I was an educator. And I remember bringing in our travel nurses and helping them and supporting them. And I actually did support the one nurse who was an agency's nurse who came back in, and he actually was hired, after his contract was over and waited the time. He came on to the same floor that he had traveled to. And he was a tremendous support and success on the floor. And one of the ways that we were able to kind of monitor is because as his educator and manager, I knew what his competency level was. I did intentional leader rounding. I understood I don't want to say I understood it all, but I made myself available and present for every patient on every unit that I worked with. I worked with the staff. I had an open door policy to say, come in and talk to me. What's happening? If you're concerned, I had one nurse actually call me and say, Trish, I'm getting ready to do this one procedure. I don't want to get too technical. She was doing a procedure for the first time that I had validated her competence for. I'm like, I'll be right there. Went up to 7th floor, talked with the patient that was there. The other staff was, and they saw that relationship and they're like, okay, this is okay. It's about building the bridges and sustaining the relationships through a partnership of respect and trust. And it goes whether you're working with your internal staff or you're working with, or maybe both, with your agency staff that are there keep an open door policy, be present, be available, and know that you've built that trust and respect from vendor to hospital or to post-acute organization. There's a reason why you've been successful together. And again, when going in and working with patients and residents, lean in and ask, how is your care today? And you ask those questions. That's where you see it. And also your workforce engagement surveys come out. They're going to see whether there was this animosity and this friction between the travel nurses and your staff. Because for me, it was about one big family, both in the acute and the post-acute space. And we saw our outcomes to sustain. That we didn't have, I can say it now because it's historical, we didn't have any major, Joint Commission or CMS issues. There were no, significant issues or barriers when working together with a vendor that you trust, that you validate. And you as an educator or someone who is working at the facility rather than the agency, you have a huge responsibility to meet that vendor partner where they are. And you guys work together for the patient and resident for their best outcomes and experiences.
Thanks, Trish. So let's talk a little bit about real world conditions then. I mean, I think you guys have been including some of that throughout the conversation, but Brooke, you're living all of this right now. So tell us a little bit, the ideas of these partnerships sounds terrific, but when your nurses are on the floor and, you're integrating new people into your workflows, trying to get them to be partners with your staff, what can be done to kind of smooth that process and build relationships both between your different nursing staff, but also to make those travel or agency nurses feel comfortable and your residents feel comfortable with them?
Yeah, I mean, this is something that really excites me and something that I'm the most proud of with what we've been able to do in my facility and the others within our corporation. I know the uneasy feeling of walking into a building and not knowing what to expect. And, we can talk about nursing interventions. This is a point for those to be utilized. So before a nurse or CNA who's never been to my building comes into my building, they get a text message from my personal cell phone with all of the parking info, our address, instructions on the codes for our doors, and where to find the emergency binder. It's a text template that I save in the notes app of my phone. And I don't care if I'm in the trenches, right? You can send a 30-second text message to make sure that people feel comfortable coming into your facility. We include their EMAR login if that's appropriate for their role. And it takes 30 seconds to send out. It's a no-brainer. If any vendor staff are invited to my building, to Trish's point, they are invited into my trainings. They're in my rounds. It's not, we're going to give the agency CNA the 12-person assignment. That doesn't happen here. We're not going to create that culture, and we have to be intentional about that, right? So I also will network out to their support person from their agency and say, do you have anyone who's never been to my facility who would want to come? Do you want to come? And I find that helps build rapport and integrates them better into my staff, but also the residents know that we have a unified front of training people. And I can say to my family members, no, they get trained right alongside my staff. I am so comfortable because I did the training for them, so I know that it works. We also keep a binder at my nurses station, which details our facility's expectations. That's everything from a cell phone policy to mandated lunch breaks, whether you're my staff or not. Our on-call tree and their identified support person, like I said, through their vendor agency. We also keep copies of communication forms or incident reports and a signature page. And one thing that the signature page allows me to do is hold them accountable if their ADL checkoff list isn't done, but it's in my expectations binder that before we punch you out, it'll be checked off. And then we can also follow up with their quality team if needed. But I think it's so important to address it with the caregiver first and in real time before they leave my building. And that will require, to Trish's point, that I need the tech support to be able to be present on the floor. And that's where these partnerships are really going to thrive, to allow us to be able to follow up on things and to ensure that the care delivery is there. I'd love to hear some other ideas on this as well, because it's so impactful to creating partnerships. But really, at the end of the day, integrating your partners into your staff needs to be a no-brainer for you, or you're already stepping off on the wrong foot. And like we said, we're already banking for losses. You need to invest in that partnership first.
I love how you mentioned you have that direct conversation with, with the unfinished ADLs before somebody leaves. I'm a true believer, going back to the very first point that Rebecca said, which is about retention. I believe that A players want to have a boss that has A plus expectations. So if you treat that person with the standard that you have for everybody else on your staff, that person's going to be excited to come back, and that person's going to think, oh, I want to work for that boss forever.
So my mom, my aunt were all directors of nursing. I worked in a long-term care facility as a nurse as well. And the truth is that we all realize that there is a serious shortage of caregivers, and we are burned out. And the definition of burnout is meaning that, for me, at least as a nurse, I was unable to deliver the care that I would want to be able to maintain my outcomes for my patients. And that is a very personal and frustrating experience being a nurse. When you know that you've stepped into a facility and you can't get everything done to make sure that that patient is better off when you leave than when you started. And that, I think, is what a lot of our caregivers are facing right now. There's not enough CNAs. There's not enough nurses there. And the truth is that what we're also seeing is that many of these nurses who are working, we know that 80% of nurses go part-time or per diem as soon as they have their first child. This is well known across the industry. We know that Mayo opposed the Keep Nurses at the Bedside Act just 6 weeks ago because they said 56% of all nurses within the state of Minnesota work part-time, and they couldn't commit to committees to manage staffing ratios because they just didn't think there was enough nurses that would be able to manage safe ratios based on acuity levels within their hospitals. So fundamentally, the industry is not keeping nurses at the bedside. And the truth is, for us, that causes us as nurses and CNAs moral injury and distress to constantly show up and feel like we did not get to do our jobs. That burdens us, that breaks us down. And I think the truth is that as much as I wish we had enough nurses who would love to work in all settings, I wish that I had plenty of nurses, even within our own organization and CNAs, who want to fill every single shift that is put on our system. The reality is there's not. But as long as we continue to keep our CNAs and nurses always walking into situations where they can never do a good job because there's simply not enough staff, that is something that is going to perpetuate this problem, not alleviate it. So I think that if we're looking at real world situations, is that I don't see any short-term solution to the crisis that we have. The only things that we can do is start working together better. Because the truth is, at the end of the day, it's not only our patients, but it's all the nurses and the CNAs in the world who are leaving to go work at Target because they're getting a discount and getting paid $21 an hour to work at Target. And they don't have any of the risks that they have when they come into care for patients like we do. And I think, let's be very honest, we should address the real world scenario that a lot of our frontline caregivers are now facing criminal prosecution for things that result in harm to patients, largely because they can't get all the work done within that. In the state of Ohio last year, the Attorney General of Ohio prosecuted over 100 CNAs and nurses criminally for outcomes within settings, but they prosecuted no home care providers. So I think that what you also have to look at is the collective psyche that is hitting this workforce, looking at competitive wages and other environments that they're not going to risk going for jail if they make a mistake. And we fundamentally must start owning that as being part of this community and pushing back at what's happening to our frontline caregivers who are doing the best that they can when they show up in these environments and these communities.
Mm-hmm. Oh, everything that you just said. And to go back to the research that was just published from October, it just released this year, finished last year, where you have, 25% of clinicians are ready to walk out. They're leaving healthcare altogether. And 90% were citing burnout. They're overburdened with too much. There's so much they have to do. There's so much they're responsible for, and they don't have the tools and resources to do the job. They are fully trained, capable, competent, have everything they need, except they walk into the buildings or they walk into the hospitals, and there's so much in front of them. There's this administrative burden. And that's one thing that our CEO, Jackie Ramieri, she looked around as a fractional CIO, and she said, there's all this work, all this administrative work. We need to find a solution. She couldn't find one, so she created one. That's why we have CareWork. And I'm looking, again, we're reducing I'll say it this way. We are removing the manual and automating the analysis to support the preservation of margin and margin recovery over the course of the last couple of years. And you think about the nurses that are coming in and the CNAs as well, that they can choose to go anywhere. They can choose to go anywhere and work. Brooke, to your point, I'm so glad that you stayed in. I'm so glad that you stayed in and you are thriving in your role. And you are a light and a pillar and an example for everyone who's on this panel. And I'm looking at you and I'm celebrating you and the work that you're doing. And look what your teams are seeing in you as a nurse, as a leader. You're intentionally leaning in. I don't want to say as a former educator because it makes me old, but as a former educator, hearing you say that when your staff would come in or your travelers would come in, you send a letter, you had that automated, you had it set up so they would get this information. I did the same thing like 176 years ago. I had letters. I would let them know as soon as I had my HR partner said they were coming, whether they were agency or full-time. They got a letter from me. They got a text from me. They got an email from me. I let them know where to park, what to wear on the first day. Yes, lunch will be covered. It'll be a full 40-hour work week. I'm going to see you at 8:25 at the first break in the room. I'll come find you. This is what I look like. I'll have my white So all of those things didn't matter. You were, I don't want to say my staff, but you were my staff. You were my people. I wanted to bring you in and help you assimilate into that environment. But educators today, do they have the time or the resources, the tools to do that? With that state, you're doing it. And again, you are a shining example of the way to do it. But across the board, we're seeing so many people that are saying, peace out. I got my 2 years in and I'm out. I'm done. I want to find something else to do. And, as a seasoned nurse, I won't say old, seasoned nurse, I'm in the over 50 club, and I still volunteer with the state of North Carolina because I want to continue to serve my community. And I think about what our new nurses are coming into, and what we can do to help them so that when they walk in, Rebecca, to your point, that they're facing all this work that they have to do. And Peter, you said it beautifully as well. They're walking in going, I can't possibly get this done. I can't. And then you said it as well, Rebecca, there's risk of prosecution. So what is it that we can do now? And it goes back to finding vendor partners, leaning in, proactively addressing the issues and saying, you know what, we've done it this way. It's not working. We need support. We can do it ourselves and continue the same, or we can find a vendor partner that we can get with that understands us, has been there, experienced it, and can help them to achieve their long-term operational excellence goals. But in the short term is to recruit and retain the best. And when you have that quality, validated, respected partnership with vendors, multiple vendors, it is transformative in your organization and for your business operations as a whole.
Thanks, Trish. I want to thank you guys. This has been a great conversation. I would be happy if I were a nurse to work for any of you from the sounds of it. So appreciate all of your perspectives. We have a good amount of time left for Q&A. So I'm going to start with a couple of questions that came in that are pretty closely related to each other, but also to what Rebecca was just talking about with that idea of never getting anything done. One of our audience members asked about having so many tasks that maybe you get your task work done, but you're not able to work to the top of your license. Can you talk a little bit about the frustrations that come along with that, of knowing that you're capable of doing more, and yet the busy work, the rote work obligates you and doesn't give you that fulfillment that could come from being at the top of the license?
Brooke, do you want to go first on that?
Sure. I think we've all been there, right? We've all experienced those frustrations. And it truly is, to your point, Rebecca, moral injury. When I was experiencing those feelings and having to walk out of my building feeling that pit in my stomach, what does that look like for nurses? Because we're all going through it. And a part of that was indeed the pandemic. But what I would challenge that with, what does it mean for these nurses, for your specific nurses, know your team, to work at the top of their license? What does that look like for them? Because that, to me, like, of course we can work at the top of our licensure and the tasks don't help. But to my point, what can be eliminated through care partnerships? What can we outsource to administrative, team members? My daily census is done by my administrative staff. All of my assignments are printed by my administrative staff. Nurses should not be wasting time printing and editing assignments. It's not valuable. Same with censuses, same with training information, all of it. Outsource to your admin team as much as you can. And as much as I hate to say this, squeaky wheel gets the oil. Be vocal about where you're meeting barriers. And if you're solutions focused, my staff knows this. Come to me with a solution. If you don't have one, we'll brainstorm one together. The other thing you do when you come in my office is you tell me something I don't know about you. My staff get frustrated. I had one say to me yesterday, do you want to know where I get my coffee in the morning? I'm like, yeah, because then on staff appreciation, I'll get you a gift card to your coffee place, not mine. That's how this works. And so as far as wanting to work at the top of your license, being bogged down by tasks, it needs to be a conversation because there are ways that we can mitigate those really high stress times, especially during high care times. And that needs to be a focus.
Yeah, and I'll just back up Brooke on that. The truth is that you have to delegate. And now you're going to say, I don't have the staff to delegate it to. But I think, honestly, everybody does want to practice to the top of their license. And the truth is what you're going to have to do is you're going to have to empower those CNAs to say, go to the top of your level's license, do what you can. And then when you're also short-staffed, I have to tell you, there are many times that I would call the front desk. I'd call the secretaries and I'd be like, look, I need help with trays. I need help with pickup. I just need you to walk around and do a wellness check on the floor for me so that I can go and do those things. And it comes down to the culture within your building. If everybody recognizes that you're there for the patient first and that they all may have to do something outside of their job description or role or definition, the truth is that you build a culture where everybody leads in and you all rise together as opposed to drowned separately. And that is something that we need to start bringing back to our homes. And there are little things that you can do when you start doing those things. And it's just saying thank you. And I know that sounds so menial in that kind of direction. But when you really make it about the team and the success that comes from the team, and I remember one of my best managers I ever had said, we either survive as a team and we thrive or we will fail. And so I need you all doing everything you can to make sure that we get through this difficult time. And we saw the best of that during COVID. People that showed up in long-term care did things that they had never done before so that patients survived. And that is what we need to get back to on a daily basis. And I know that can sound exhausting, but also it can be incredibly rewarding. And that is where I think we need to really be looking at, go to your top of your license and ask for other help in places that you normally typically don't have them. And then to Brooke's point, when those areas fail, it's time that you're loud and vocal and say, I can do this much. And the truth is, Mr. CEO, I'm going to need you to step in and start providing me support here.
Can I add another twist to this question? I want to make sure I give you guys a chance to weigh in on this part too. If you see that eagerness to do more in an employee, whether that might be an agency employee who's really good at their job, but you see potential, can you talk a little bit about recognizing that interest and maybe some of the pathways or training opportunities to make sure that they feel fulfilled and keep staying with us?
Yeah. I have a Jessica, and I tell everybody this, but Jessica was a nurse who saw me when I was a CNA and said, you've got it, kid. And I think we all need to be that for each other. So I have my CNA license hung on my wall and a little crocheted thing she made me when I graduated nursing that says, be a Jessica. And we have to do that. If you see it, you call it out in real time. We're not waiting to email a rep and say, oh, this person was great today. Hey, I really love what you did. Thank you for doing that. Come into my office and let's talk about your goals and how I can support you. Because I think you've really got something special, kid. And I want you to know that I'm behind you 100%. And I think it's really important to figure out what motivates people. To Peter's point, what's your love language? How can I get to know you? How do you form relationships? And noticing that about people, Peter, I think that's one of your really strong points in your podcast specifically. You really have a wonderful way of connecting with people. And we have to humanize this industry in order to keep humans well fed emotionally.
Yeah.
No, I think that's
I
a
agree.
great
I think
point.
Sorry, go ahead.
No, Peter, go ahead.
No, just to follow up on that. And, I do sessions at different conventions about the book, 5 Languages of Love. And, not everyone's good at words, but you can be good at something else. So maybe slow down and give somebody quality time. And if it's someone from an agency and you just slow down and you turn off your cell phone and you look at them and you listen to what they need and they say, hey, I've struggled with this, this, and this. And they feel that's also showing them that you appreciate them. And then, like you said, Rebecca says, then you go to your CEO and say, hey, I heard this from 2 different people. Let's get something done so tomorrow's different.
No, that's such a great point. And I love hearing what you all are doing, and you're making significant impact in someone's life in the moment when you're fully present and you see it happen in the moment. And you're like, yeah, we're gonna make this recognition happen. There are different awards that patients can actually send in, for their staff that took care of them. I think that's a huge opportunity there as well. But when you have that time and you see someone, especially someone who doesn't have a title, I just remember in my experience, all the years at the bedside as a manager and as an educator, as a director, and I would look around and I'm like, Susan, I just want you to know, I saw the work that you did with Mr. Johnson. And when I rounded on Mr. Johnson, he commented on all the work that you did. And I remember, just an example, and they would look and go, oh my gosh, you knew that? I'm like, yeah, I did. So then if they were okay with it, I'm like, I really want to say something about the work that you're doing at the next stand-up or at the next, morning session or the unit meeting or staff meeting. And, I never want to call them out if they're not comfortable with it. Maybe I could just write them a hand note and send it in the mail. But it's getting to know, whether they want to have that call out in front of people or not. But understanding from the patient or resident perspective and what the families are seeing and saying and experiencing about the staff is huge. And so, Brooke, I absolutely celebrate that you see that. And when you see it happening, you call it out. And then having an opportunity, to recognize someone who may not see in themselves what you see. And you're just, you have that letter, you have your certificate, and you have the what she sent you. That's transformative. And look what you're doing now. It transformed you into, it helped you to become who you are today. And again, I'll say it. I celebrate the work that you're doing with the boots on the ground. And I'm sure you hear it. You hear that a lot. But I from my heart to yours, I just celebrate the work that you're doing and supporting the work, the hard work. I've been away from the bedside now for about 7 years, and it's not a day that I don't miss it. So I celebrate the work that you're doing, and knowing that people are watching you and seeing you and saying, I want to be like her. I want to be like Brooke. I want to do that. So my hat's off to you.
Thank you.
And Kim, I'll just quickly say real quick to Brooke, a lot of our frontline, all they get is negative feedback all the time. Oh, you forgot to do this. I need you to work Saturday. No, you can't have vacation time. You made this mistake. No, you're getting written up. And a lot of negative feedback comes to them on a regular basis. And I think what is just always so shocking to me is exactly when Brooke looks at somebody and says, you got this. I see something in you. How rarely that especially happens to populations of those working in long-term care. If you look at our population, vast majority women, vast majority minority background, many single moms, many coming from lifestyles that were baked in poverty, very few people ever told them, you're worth something. You're worth investing in. You can accomplish more. And so I know that seems almost too simple, but when you take that moment, you have to recognize that their feedback cycle has largely never been somebody to stop and say, you can do anything you put your mind to, and I appreciate the work you delivered. So the reality is if you can start there, you're going to change the lives of people who every day walk into environments, risking themselves, their health, their families, to take care of people that most other people never will. So take that moment to tell them that you see something special in them. Because every day I meet with my CNAs and nurses that go out there, they are changing lives and doing things that I know that if it wasn't for them, there would be nobody else behind them to do it. And we got to maintain them at that bedside.
All right, Rebecca, I'm going to give you a 30-second answer option to see us out. I want to get to one last question here. In talking about supporting those employees, what are some ways tech maybe can help when it comes to reliability and accountability, particularly with the agency staff?
Let's be very honest. Nurses want to pick up shifts when and where they can't They want to be able to give feedback. They want real-time feedback. They want to know what they're doing well. They want to know what they're not doing well. So use technology to drive those efficiencies, track those ones that you like, that you need, and then those that need improvement, and make sure that you're constantly engaging with your partners so that they know what you need for you to be successful. Because the truth is, if you're not successful, none of the tech that you have, none of the experiences that you have are worth a dime, because you need to be successful, and we should be making that happen.
Perfect. Thank you so much. And again, thanks to the whole panel, Rebecca, Trish, Peter, and Brooke, for their perspectives here. We'd also like to thank our session sponsor, which is IntelliCare, and you can learn more about them at IntelliCare.com. We want to thank you, our listeners. You've helped make today a great success with some excellent questions here. Of course, we invite you to come back at 3:30 Eastern for our next Expo session, which is Technology Implementation strategy, best practices for senior living communities. And finally, this session and all of those from today will be archived and available on demand shortly after this live broadcast. You can access it again or share it with others by entering the studio at mcknightseniorliving.com/061523 online expo. Once again, thank you all for being here. This is Kim Marcellus for McKnight. Have a great afternoon.